Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Gas gangrene. So what is the most common organism causing the gas gangrene? The answer is it is Clostridium perfringens. This is an anaerobe. Now the risk factors is that it can cause, it is because of diabetes mellitus, it may be due to this, or in case of immunocompromised state, the wounds with necrotic and foreign materials which promote the anaerobic conditions. Then moving on to the clinical features. So here in the clinical features, it can include the severe local wound pain. So wound pain, then the gas in the tissues, as well as there is a thin brown dishwater appearance, and sweet smelling exudate from the wound, as well as there is a sweet smell exudate from the wound. Then comes there is a myonecrosis, as well as the main thing being it includes the gas and the smell. Now looking at the diagnostic aspects. Diagnostic, in case of specimen, it can be the necrotic tissue as well as the muscle fragments. Microscopically, the Clostridium perfringens, it shows a subterminal spores. Now what about the media? The media is it contains a Robertson cooked meat broth. So RCBM, Robertson meat cooked broth, is what is seen. And the litmus milk. So litmus milk is a stormy clot forming on the litmus milk. So it's a stormy clot formation in case of the litmus milk. Next is the target hemolysis. So target hemolysis, there is a double zone of hemolysis. So double zone. And the reverse CAMP test is positive. CAMP becomes positive. So how do you treat this? Treatment is by the administration of the IV penicillin and plus the debridement of the affected tissue. So what will be the prophylaxis? The prophylaxis, it includes the antibiotic prophylaxis. So you give the antibiotic prophylaxis, as well as there is a passive anti-gas gangrene serum. It's a passive anti-gas gangrene serum. So this includes the IgM generally as well as the IV. So you administered IV in case of the emergency. So also it took the closure of the traumatic wound delayed for about 5 to 6 days. To learn and grow daily like this, please do subscribe.